6.5, we are going to talk about injuries and disorders of the nervous system, and this will finish off our chapter 6 finally. The first thing we're going to talk about is traumatic brain injuries. This is going to be abbreviated with TBI. So what exactly is a traumatic brain injury? It is a violent impact that you have to your head. This can be caused by a fall, a car accident, even there's a lot of people who get hurt at work. And this is going to result in some kind of trauma, which can range from mild to severe. And based on that will also determine how severe your brain injury is. So you've probably heard of Phineas Gage. If not, he is a classic example that we use nowadays for people who, when we refer to traumatic brain injury. Basically, when he was 25 years old, he had a 3.5-foot iron rod that blasted through his skull. And if you look in the image down below, you can see that there is a rod going through what looks like his frontal part of his brain. And what's crazy is how he reacted to this injury. So basically, after he had this blow, he was able to walk and speak for a couple of minutes once it happened. But as he was recovering, people noticed, it was a very slow recovery, and his brain was swelling and kept swelling to the point where he did end up in a coma. But after that, he ended up making a complete physical recovery, and he was able to live for 12 years after the incident. But he had many seizures that occurred because of this, and as they increased more and more, and in more intensity, he eventually did die. So the effects of traumatic brain injury is at first the prognosis varies. So it depends on the person. It depends on the age, how, if you had any previous ailments that could make it worse. And then usually people who have survived a traumatic brain injury do require rehab for a while because they have lost some sort of motor effect or something like that. So they do require a rehab for some time. And then if this traumatic brain injury is not taken care of or resolved with whether medication, rehab, or just your body being able to heal itself, it can end up that that person can go into a coma, and maybe they'll be able to come out of it. Maybe cerebral palsy, also abbreviated with CP. So cerebral palsy is a disorder of your nervous system. So it's from some sort of brain damage, and it usually happens before birth. So you can probably determine if that baby has cerebral palsy or not to about 1 year old. And like I said, it is present from birth, and some of the defects that it includes are abnormal brain shape. So it is physically, you can tell if a child has cerebral palsy or not just by the physical shape of their head or their brain. You can also have damaged nerve cells and brain tissue. And then there's also something called maternal rubella, which is a virus that a mom can contract while pregnant, and it can pass to the baby, which can be pretty dangerous to the baby. But it doesn't necessarily harm the mother. And there can be a lot of brain infections, head injury, and liver function that go along with this as well. Some of the common symptoms you'll notice with cerebral palsy is impaired motor function, so they're not going to be able to do a lot of things on their own. And this can affect either one side of their body or both sides of their body. Spastic cerebral palsy is a specific type of it, and it's the most common form of cerebral palsy. Symptoms are very tight muscles and joints. You can also have very weak muscles, gait disturbances, which is basically you're not able to walk normally. And the treatment is that there is none as of now, but there is a lot of therapy that can help improve your quality of life. So a lot of people do go to therapy to kind of just loosen up those tight muscles and joints and see if they can get back some motor movement. Spinal cord injury. So causes of spinal cord injury is some type of vertebral fracture or displacement. If you look at my diagram that I drew over here, you can see that this cerebral, or this vertebrae right here, is not in the place that it should be. It has some cracks in it, in the bone, and it is causing damage to the spinal cord, which is the yellow in itself. This can happen from car accidents, sports injuries, and usually it's located in the cervical region of your spine. A complete sever is basically permanent paralysis. So this is you're not having any sensory or motor function, or very, very minimal below the point of your injury. So if you have the injury occurring in your C1 to C3 spinal cord, your cervical C1 to C3, it can be very fatal. I mean, it can be fatal. You will die from it. Usually, if it happens in your C4, it's called quadriplegia, which means that I'll show you in the next slide what that looks like. And then C3 to C7 is complete paralysis of the lower extremities. So you can see pretty much in this diagram that I have over here what each type of, how each is affected. So sometimes you can just have part of your body affected, sometimes a whole body affected. The one in the previous slide where it said quadriplegia basically means you're not having function to any of your limbs, your lower extremities. A very famous case was the original Superman, Christopher Reeves, who ended up going through this paralysis, which was really sad. So you can see him as Superman right here. And then this is him later in life. Meningitis, you probably heard of, is very common, especially in youth. I know when I had to go to my college, I was required to get a meningitis vaccine. When I graduated, there were 2 cases of meningitis that came up at the Rutgers, so I wasn't sure if that was because prompted out of, they didn't have to take the vaccine due to religious beliefs or whatever it was, but unfortunately there were 2 people who got meningitis, so it was very serious. But basically it's the inflammation of your meninges, which we talked about is like the outer covering that covers your spinal cord and your brain. Symptoms of meningitis are kind of similar to any other sickness you might have. You probably get a headache, a fever, and then a stiff neck. Usually people say that if you're feeling this and you can't really touch your chin to your chest, that might be a symptom of it. But then again, there are a lot of reasons you might not be able to do that, and might not exactly mean you have meningitis. If it's a viral form, it is usually mild, that you will get better soon. If it's a bacterial form, it can be fatal. So if you have any of these symptoms and you think it's meningitis, I would definitely seek medical attention, because it can be very serious and it can put you in the hospital very, very quickly. So if you look here in this diagram, you can see a healthy brain right here, and then you can see a brain that has meningitis. So very, very different in how. Sclerosis is very widely heard of. You probably heard of it a couple times in your life. And basically it's a chronic disease that progresses really slowly, and it affects your central nervous system. So basically what it's doing is it's destroying your myelin sheath of axons. And we learned about how important myelin sheath of axons are to, send messages from one nerve to another. And destroying this ruins that and slows down the communication. And so usually it occurs in women of ages 20 to 40 years old. What the cause is, we're not really sure of. And then there are really no cures for it either. But there are ways to treat the symptoms and again, improve your quality of life. So if you look at the diagram, I have kind of symptoms that you can, see or experience when you have multiple sclerosis. There's a lot of fatigue, cognitive impairment, it messes with you visually. You have a lot of muscle weakness and spasms. You have a lot of pain. It can affect your bowel movements and your urinary tract and stuff. So it's pretty rough. Okay, epilepsy is pretty much a repeated amount of seizures that you get over time. Abnormal electrical activity in the brain is what usually causes this epilepsy. And then symptoms are, they're not very consistent. They can change over time, and they can affect your behavior. You can have uncontrolled convulsions. Again, the cause is unknown. It's a brain disease. It can be caused by a brain disease, can be caused by an injury. Genetically, you can get this. It is frequent in infants and also in the elderly. So if it's, infants, you can probably catch it on early on. A lot of people do have passed from this, so it's really sad. A lot of people, though, who have been getting epilepsy for a while and they're old enough, they can kind of know before they're going to get an episode. It's called an aura. The best way that I can explain this is probably kind of that feeling of, oh my gosh, I'm going to be sick and throw up like right before it happens kind of thing. So it's kind of like a signal that your body gets right before you go into a seizure. A lot of people get auras before, migraines or something like that. But there are ways to control it, which is through medication, and then there's also surgery that can help. This disease, abbreviated with PD, is basically, it looks like a small tumor that eventually will start spreading. Usually it's, like I said, it's small. People don't notice a lot of times, but it affects the nervous system and it impairs your movement. So it's hard to do day-to-day tasks. Eventually it's very crippling. And most of the common symptoms is just stiffness of your muscle, your body, and then which eventually causes super slow movement. This is chronic, so once you get it, it is long term. And usually people who get it are over 50, unless it is due to genetics. You can get it at a younger age. People in their 30s can have also been able to contract it because, again, it's genetic. And it can either affect males or females, so it's not specific towards one type of sex. So Parkinson's is basically what happens is the brain cells that produce a neurotransmitter called dopamine, which is super important because that is what your nervous system uses to send signals and to initiate nerve pulses. It isn't able to do that anymore. And because dopamine is not being able to be released because of the damage to your brain cells, you are losing muscle function because there is no communication actually happening. Now, there is no known cause for this, which is really sad, as many of the brain illnesses or illnesses that we go through have, especially pertaining to your nervous system. So it's pretty sad. One of the people who is pretty famous, I don't know if you guys have seen Back to the Future, Michael J. Fox. He is known to have Parkinson's disease, and the thing about it is that even not only does it, we don't know the cause of it, but there's also no cure for it. But there are ways that you can control the symptoms by taking an increased dosage of the neurotransmitter dopamine. Dementia is a loss of function in two or more areas of cognition, like being forgetful. So basically, dementia is not a disease on its own, but it describes symptoms that are associated with a group of symptoms like memory loss, impaired communication, impaired thinking. The most common form of dementia is Alzheimer's disease. I should say form is Alzheimer's disease. So if you look at this picture of a healthy brain and then you see a Alzheimer's brain, you can see how much of the brain that has Alzheimer's pretty much is deteriorated or deformed. Basically, when you have Alzheimer's disease, it's also known as senile dementia. This is progressive loss of your brain function, and it affects your memory, thinking, and behavior in a really big way. So it's pretty traumatic, honestly, to not only have it, but to also have someone who has Alzheimer's disease, to just see the way that they're degrading in the things that they can remember, the things that they can no longer do because they can't remember how to do it. There are a couple types of Alzheimer's disease. There's one that's called the early onset Alzheimer's disease. Basically, this is when you have symptoms of this disease that you start to notice before you're even 6 years old. It starts to get worse faster, and it mainly has to do with a genetic predisposition. There's also one called later onset Alzheimer's disease, which is basically symptoms are appearing later, so once you're older than 60 years of age, and then you increase the risk of getting it as you advance with age. Again, like Parkinson's disease, cerebral palsy, unless it's genetic, we really don't know the cause of it, even if it is genetic. So that ends our chapter 6. We're finally done.